up slightly. Thanks very much for joining in such a timely way, though. Just give us a minute. Should have some nice background music, shouldn't we? Okay, the numbers have leveled off a little bit, so I'll just introduce myself and I'll let the panelists introduce themselves, and then we'll get started. So if anyone does join in the next couple of minutes, they won't have missed anything too much. So anyway, thanks very much everybody for joining us. My name's Emma Gordon and I'm the Director of Administrative Data Research UK programme, which is all about trying to get better access to linked administrative data sets to support policy focused research. And I'm sure I don't need to preach to the converted, but linked administrative data is a powerful tool for understanding the causes of issues like homelessness. So we just want to explore that a bit more with the panelists today. So if I could just introduce the first panelist, and Lan Ho, if you'd like to say a little bit about yourself, that'd be good, thanks.
Hi, so my name is Lan Ho. I work at MHCLG, which is the Ministry for Housing, Communities and Local Government. And I'm a social researcher and I work in the Homelessness and Troubled Families analysis team. So I've been involved in data linking projects since around 2012. So I've worked on the evaluation of the Troubled Families programme. And for that project, we were able to bring together data on individuals and families on the Troubled Families programme. We gathered that data from local authorities and we brought that together and matched that to data from other government departments. So we were able to link to data from Ministry of Justice, Department for Work and Pensions, HMRC, and Department for Education. And I'm currently working on a similar project for homelessness data. So the department currently collects case level data on statutory homelessness from local authorities, and that data collection is called HCLIC. And we're working very closely with ONS to collect the personal identifiers, so that's the names, addresses, dates of birth for that data. And what we're hoping is that that will improve the HCLIC data collection that we've currently got, but will also allow us in the future to match that data to administrative data held by other government departments and other agencies. Thank you.
Thanks very much, Lan Ho. And Betsy, do you want to go next and introduce yourself?
Yes, hi, my name is Betsy Stanko. I'm a sociologist, criminologist that worked as a university professor in academics in the US and UK for my first part of my career for about 25 years. I then thought that I had some skills that I could join government, and that so I first joined the Cabinet Office and the Office of Public Services Reform, and then found that I was much better at trying to do change from within, and joined the Metropolitan Police Service in 2002, and worked for the mayor's office at the latter part of my career as a poach in what was called the second stage transfer, where civilians were transferred over to some of the police and crime commissioners. I've done quite a lot. So my 20 years inside policing, I basically used police data as linked data, as crime data, as just administrative data, and began to reconstruct the way in which the Metropolitan Police thought about performance information, and also shared that with the Home Office, who didn't actually have the same kind of access that I had to the spreadsheets as well. So my specialty is violence, and particularly violence against women, which I think is also directly linked to homelessness. Thanks.
Thanks very much. And Serena, do you want to go next?
Yes, hi everybody. My name is Serena Pattero. I am a researcher within the Scottish Administrative Research Centre, which is part of a ADR Scotland, ADR UK more the national level. So my area of research interests are in the fields of unemployment and labor market dynamics, but also poverty and deprivation, and more generally social and health inequalities. I'm involved in a number of projects within the Scottish Centre for Administrative Data Research, SCADR, which link longitudinal administrative data on benefits from the Department of Work and Pension, earnings and employment from tax records, HMRC tax records, and also health data from NHS Health Scotland. For Scotland, one of the projects I'm involved with is looking at the causal impacts of sanctions for claimants of job seeker allowance and employment and support allowance. And yeah, the underlying question is whether the exposure to sanctions is actually leading to worse physical and health outcomes, but also to an increase of using of health services. And this is linking data from, of course, the Department of Work and Pension, HMRC, hospital admissions, mortality records, and prescribing information. Yeah.
Thanks very much, Serena. Thanks. And just like to introduce Ben, and apologies that you won't see Ben's face, but he is with us. But Ben, do you want to go next and introduce yourself?
Hi everyone. Yeah, so sorry that you can't see me. Hopefully you can hear me.
Yes.
Yes, great. So I'm Ben Windsor-Shellard. I'm the head of lifestyle and risk factors analysis at the Office for National Statistics. And one of my team's responsibilities is to produce an annual release of on deaths of homeless people in England and Wales. So that's one of our responsibilities. And we also conduct analysis on other causes of death that are also relevant to deaths of homeless people, such as drug-related deaths and also suicide and alcohol deaths.
Thanks very much, Ben. So just for the benefit of those in the virtual audience, I'm going to ask just a couple of questions of each of our panelists, and then some questions to all of them, and then probably around 2:40, I'll switch to asking questions to the panel that come from yourself. So please do feel free to post the questions. We'll collect them up and ask them in the latter half of the session. So Lan Ho, if I go to you first, you mentioned the Troubled Families Programme. Could you tell us what did your experience working on that tell you about the importance of having good administrative data to support the delivery and evaluation of policy?
Yeah, thank you, Emma. So we recognise the value of having good data to evaluate the policy, but also to help the department and local authorities to make better decisions about the service provision. So one of the key aims of the Troubled Families Programme is service transformation, and a key part of that is transforming how we in the department, but also local authorities collect and use data. So some local authorities have done some really good work and been able to gain access to a wider range of kind of local data sources and make better use of that. So they've been able to match it together and make that available to frontline workers. And the frontline workers have been able to use this data to identify risks, but also sometimes to prevent problems before they happen for families on the programme, as well as those that may not have already been known to services. So that data has been able to provide a better understanding of the need in their communities, but also the demand for services. And at a national level, we've been able to use administrative data to evaluate the programme. So the data that we gathered from all those government departments that I mentioned earlier allowed us to carry out a robust impact evaluation. So we're able to gather data from local authorities on families and individuals who are on the programme, but also in a comparison group. And that allowed us to carry out an impact evaluation using a technique called propensity score matching. And using that data, we were actually able to attribute changes in outcomes to the programme. So we were able to show that the programme was successful in reducing the proportion of looked after children, but also the proportion of adults and juveniles that were receiving custodial sentences. And then using that impact analysis, we were able to carry out a cost benefit analysis and show that the programme actually provided value for money overall as well. So it's been really, really helpful for us in the department.
That's really excellent, and a long journey to go on, but really, really worthwhile. Thanks very much. I'm sure we'll have some questions about that later, but could you just tell us about MHCLG's responsibility for homelessness reduction policy for England and what your plans are around data linkage there through this H-click data collection?
Yeah, so the Homelessness Reduction Act, that actually puts a responsibility on local authorities to support a kind of wider group of people who are at risk of homelessness. And we're just starting a project in the department to further improve the evidence that we have available on homeless using that H-click data collection that I mentioned earlier. So we're working with local authorities so that they will start providing us with their personal identifiers, so the names, addresses, dates of birth, that we can then use alongside our case level homelessness data. And that's going to allow us to make better use of the H-click data that we already collect, because we will be able to see if cases are cycling in and out of the system, and also if they're moving across local authority boundaries. But the personal identifiers ultimately will allow us to match that data to other sources. So as I mentioned, some of the government department data that we use for troubled families we're interested in matching to. So the data from Ministry of Justice and Department for Work and Pensions. We're also hoping to get data on health outcomes. So that's something that we're working on. But we do think that bringing together all that data from all the different sources and the kind of the wealth of historical data that you can get from that administrative data, we're hoping that that's going to help us improve our understanding of the causes and consequences of homelessness, but also the factors that are associated with some of the better outcomes. And that will ultimately support better decision making. Just in terms of kind of like recent events and the way that we're supporting policy with that, the H-click project, if we can collect these personal identifiers, that is going to provide a unique opportunity to better understand more about the impact of recent interventions for rough sleepers. So local authorities have been asked to actually enter those cases into the H-click data collection. So that's something that we're hoping that local authorities are doing and that we'll be able to collect the data on. So it's those who've been supported as part of the Get Everybody In campaign during the COVID-19 pandemic. So those are people who've been sleeping rough or are at risk of sleeping rough. And then what we're doing is we're hoping when we capture those in the H-click data collection, that will allow us to look at their short-term outcomes, but also in the longer term, if we can link it to other data sources, we can also look at the longer term outcomes for some of those rough sleepers. And we do believe that some rough sleepers may have improved outcomes because of the recent intervention, but we also anticipate that some might disappear from the H-click system. So if we can link that data to other data, to data from other government departments, we're hoping to be able to see some of the longer term outcomes, even for people who drop out of our H-click data system. So that's kind of the work that we're doing at the moment.
That's, obviously very, very timely, and I'm sure we'll come back to the response to the COVID pandemic later as well. Thank you very much, Lan Ho. Betsy, if I move on to you, so in your previous roles working with the police, can you tell us what we know about homelessness with respect to the criminal justice system?
Yeah, we certainly know that, and this is the important thing. I just wanted to add to something that Lan Ho said, it's not that we need the names of people or we need to know the names. We need that information to link a lot of other kinds of information that we hold. And so as a specialist in violence, so as I was, when I was the director of the ESRC Violence Research Program, people told me and told my researchers that actually you wouldn't find a lot of things about violence because it's not recorded anywhere. It's not part of the record. And one of the things that we did find in that work over 5 years was actually there's a lot of violence in administrative records. So I became 20 years ago kind of a rabid advocate for the use of routine information for studying the kinds of things that people think you can't study by looking at, can you really study aging by looking at crime? Well, yes, actually you can. Can you think very, very differently about a subject, homelessness, through the lens of a criminologist? But what do we know more? Well, first of all, homelessness has homeless people and rough sleepers really high rates of victimization. Victimized by members of the public, victimized by each other, high levels of fear of crime, for example. But nobody ever asked them because he only asked residents about fear of crime. He never asked people who were living on the street about fear of crime. High levels of domestic violence and experiences of violence in the home. High levels of substance abuse, high levels of mental health. So all of the kind of markers of help which are missing really out of that data, but you see them coming in through victimization data. You see people having episodes on the street. You see the hidden costs of domestic violence, people leaving home, young people, certainly during COVID, which we can talk later, who got chucked out of their homes as stroppy teenagers and had no place to live. These are all the kinds of things that are linked to homelessness, but we still study as victimization or domestic violence, but the knock-on effects across government and across government expenditure are extremely high, very, very high. And so I learned from using police data that as a sociologist, not as a police officer, that you could learn a whole lot about people by looking at crime data. And usually people wanted to learn about crime, and I wanted to learn about the people first in order to think very differently about the kinds of interventions, the kinds of programs you have and can offer, and what happens next. So outcome level lens as opposed to incident level lens.
Yeah, very, very good point, Betsy. And knowing what you know now about sort of improvements to data collections across government and improvements in data sharing and access to researchers, are you more hopeful for the future and that we'll learn more about the characteristics of these people so that we can better help them in the future?
Absolutely. So I've been lucky to be part of the acting as the external senior advisor to the Data First program, and that's through the Ministry of Justice. And what's happening is through a very clever, very good people inside the MOJ preparing their information to be deposited into ONS and to be able to be linked to other data sources. So that's for me been a pleasure to be able to focus on, you can do this, we can learn a whole lot from this. Already there is a data set from a match data set with DFE and the Police National Computer to learn about, what are the kinds of educational experiences of people who have offended, what's that like? And now a deposit of all of the magistrates' court data from 2011 to 2018. Rich source, about to be followed by the whole major trials of information in MOJ, from Crown Court data to probation information to prison data. Really rich data source, but richer and can actually only really be understood if it's linked across to health, housing, education, DWP stuff, benefits, we then know what's happening with people's lives and begin to think about how we better direct policy to minimize, one, their impact in terms of offending or victimization, and what are the interventions that seem to do better, and where should we bring those in at the right time.
Yeah, thanks very much, Betsy. And yeah, it's really good all that data is being made available through the ONS's Secure Research Service that ADI UK are funding the expansion of, so that researchers working on accredited projects can actually start, really using this data to inform government policy and research more generally, much more widely. That takes us on nicely to Serena, who's part of ADR Scotland. So you mentioned the benefits sanctions work that you've been researching. Could you tell us a little bit more about that and how it links to homelessness in Scotland?
Yes, so I mentioned that our research question is actually focused on how the impact of sanctions, so sanctions affect the physical and mental health of benefits claimants. And we are hoping that by linking longitudinally data from different sectors, so benefits data from the Department of Work and Pension, employment and earning histories also from HMRC, and hospital admission, prescribing outcomes, and mortality records from NHS Health Scotland and National Records of Scotland will allow us to really look into the consequences of exposure to sanctions for these individuals. And so for claimants, and looking at variation across groups, that also impacts on labor, short-term, medium-term employment outcomes and earnings.
Could you just briefly explain what benefit sanctions are, just in case people don't know in the audience?
Sorry, I'm taking it for granted. I apologize. These are interruptions of, so temporary interruptions of benefits payments that are imposed to claimants when they do not comply with certain requirements that are made in order to receive these benefits, and this can have quite important consequences. So we plan to adopt a natural experiments type of approach, and in order to look at this. But let's say that we started off, this is actually a first phase of a program, a wider program that is looking at the wider impacts of benefit sanctions. So we were interested in looking at, for Scotland, at impacts in terms of educational outcomes for children, but also housing insecurity and criminal activity. And this is so we started by, I'm involved in a sort of a review of the quantitative evidence on the international level, and we found that, for example, that there are only few studies that are looking at the wider impact. The majority is actually focusing on the labor market outcomes, and so this is actually emphasizing the need for this type of studies. And in terms of, so this is, in the longer term, we will look also at homeless outcomes. And I'm currently also involved in a project that is looking at, that is in collaboration with other researchers in SCADR and the Policy in Practice, which is a third sector organization to bring together data from the local authorities on housing benefits. These are benefits policies set up by DWP but administered by local authorities. And in the longer term, so the idea is to look at transitions of households in and out of poverty, low income circumstances, but also there is potential to link this data to homelessness data that are also held by local authority. So this is let's say the program of work that have links to homelessness I'm involved with.
That's really interesting, and really good to know that so much is being done in Scotland. And I know you've got a really good setup in Scotland for linking right across different areas of policy and research, and particularly really good access to health data. So yeah, definitely would like to hear more about that. Ben, if I just turn to you, you mentioned that you publish statistics on deaths of homeless people in England and Wales. Could you tell us more about what the stimulus was for ONS to start doing that?
Yeah, sure. So our deaths of homelessness release has been going for a few years now, and I think when we publish next time, it'll be the third publication. So until we started doing these publications, deaths of homeless people had never been reported, and therefore there was a huge evidence gap to be filled. And before we started doing the work a few years ago, there was growing interest in deaths among homeless people. So there are a few things that happened at the time. So there's the Homeless Reduction Act of 2017. And this act, it kind of reformed England's homelessness legislation by placing duties on local authorities to intervene at earlier stages to prevent homelessness. And following on from that, there are a number of new initiatives. For example, in the Ministry of Housing, Communities and Local Government, there was a new rough sleeping team formed to help drive the reductions in rough sleeping, and also more money made available to local authorities to help as well. So I guess the kind of simple answer is that we started doing the work because there's a huge evidence gap to be filled, and the evidence is a very important part of the work that is going on to help reduce homelessness.
Thanks very much, Ben. And just looking through your recent publication, it's really striking that what you're reporting. So, you know, the 31-year disparity in age of death of homeless men compared to the general population, which is even greater for women. It's 38 years difference between the average mean age of death for homeless women compared to the general population. And there's around a 40% of homeless people that die of drug-related causes. It's a question for Ben and the rest of the panel, really. So are there other data sources that we should be considering linking this mortality data to, so that we can better understand these people's lives, so that organisations can then support them better?
Yes, so if I answer from my point of view to begin with, and I think, yes, definitely. There are other data sources we should be considering, particularly in the context of homeless deaths. So in the Office for National Statistics at the moment, changes in law that occurred last year give the office power to acquire new sources of data from other organisations, to help out with some of these really important questions. So we do have a programme of work where we are developing a number of different linkage projects. So these include data that's already held within the ONS, such as the census. So the last census was conducted in 2011, and the next census is due to be conducted next year. And the census is full of very rich demographic data. which can, of course, help us to understand a number of different risk factors that may be implicated in things such as deaths. And we've also acquired data on hospital episode statistics. We're in the process of acquiring GP data to allow us to look at primary care. And we also have data on psychological therapy today, our IAP data. So we're using all these data sets. I think they really do have great power, and it's definitely, data linkage, particularly when trying to understand, homeless deaths and the risk factors involved in homeless deaths. Data linkage is definitely going to be the way forward. But there is going to be some challenges ahead with that. So a lot of the data sets are linked together using information on addresses, names and dates of birth. So there are some difficulties there. But I genuinely think, that these linkage projects that we have in the pipeline will really help to understand the risk factors surrounding homeless deaths.
Thanks very much, Ben. Really good to know. And the Digital Economy Act that you referred to there, that was enacted fully in 2019, that has permissive powers to allow data to be shared with researchers through the ONS Secure Research Service that referred to earlier. So it'd be great if this data, once it is linked, if you're using it for statistics, that it can also be shared with researchers more generally.
Yeah, definitely. And I think that's really important because, we can only do so much with the time and resources that we have in the ONS. And sometimes these really tricky questions, are best to be answered by academics who have experience in statistical modelling and very complicated analysis that we don't necessarily have the time to do, even if we really want to do it.
Absolutely, yeah, and getting that expertise in from academia and the wider research field as well across third sector organisations is really important. Does anybody else want to come in on that topic before we move it on?
I'd just like to say that certainly I would think that offenders with under 12-month sentences would be another key place, because my sense is that's a churn, lots of repeats, and people with issues around substance abuse and other mental health issues. And my sense is that might be a serious churn factor in terms of keeping people on the street, but then periodically taking them off and then putting them back on again. So I would think that that would be a key data set perhaps to link with what Ben's talking about.
That makes a lot of sense, because until we know what the churn is, we can't do anything about it essentially, and having that hard evidence through linked administrative data will really help us know how better to support these people so that they're not cycling through that cycle endlessly throughout their lives. Absolutely. Lan Ho, this kind of touches on the Homelessness Reduction Act as well, and could you say briefly how that has kind of helped support this policy area, and where you see further improvements being made?
So I think that with the introduction of the Homeless Reduction Act, that's when we introduced our case level information data collection as well, because before that, as a department, we were only collecting aggregate level data, which really wasn't very good in terms of understanding all the the factors that led to people becoming homeless and more about their characteristics. So the data that we're actually collecting through our case level data system has really improved the evidence already. And there's lots of other projects that we do within the department. We've done a lot of work within our team to help improve the evidence base for homelessness. So one of the teams in our department has actually collected quite a lot of information through something we call the Rough Sleeping Questionnaire. So there's been various projects over the last couple of years years, where we've actually carried out interviews with rough sleepers, and we're trying to bring that in and link that to data from DWP and other organisations. So we're talking to Health and Ministry of Justice about setting up data sharing agreements to kind of like bring all of that data together so we can understand more about rough sleepers. But I do think that one of the things that we were interested in as a department when we were talking about this project was, again, about linking to the mortality statistics and just kind of like bringing not lots, but the kind of like the data sources that I've probably already mentioned. And I think some of the ones that Betsy was talking about around the police data would be really interesting to understand more about domestic abuse, because we really struggled to capture that in our troubled families evaluation, and health as well. So it's really interesting that Ben says they've been able to access some of that kind of hospital health data that we've really struggled with. So all of that, I think if we were able to bring together data on a range of sources with our HCLIC data and maybe some of our rough sleeping data, I think we would really be able to understand a lot more about the characteristics and some of those factors that really do affect the people who are homeless or at risk of homelessness.
Yeah, and these people clearly have, really complex lives, and the more that we can understand about them, the more we can do to help intervene earlier to support them, so that you don't get the really terrible outcomes of dying on the streets. Absolutely. Serena, is there anything you want to say about what's been done in Scotland around this? Are you aware of what the government colleagues are doing?
Yes, and also through projects I'm currently involved and developing with the colleagues from SCADR and Scottish Government. So due to the COVID-19 situation, actually there's been recently established an intelligence network that has led to a data task force, which brings together key data sets from from NHS Health Scotland, NRS, National Record of Scotland, but also other data sets that are that would allow us to, or researchers or analysts in the Scottish Government, to understand the socioeconomic risk factors associated with COVID-19. So for particularly vulnerable groups in the population. So these data sets include pupil census, so educational data on children, but also other data sets on child protection, look after children. There is census data that is part of this data hub, but also data on homeless applications, and we are hoping to get also DWP. I mean, and I understand the Scottish Government is hoping to get DWP and HMRC data to look at the, as I'm involved in a particular projects looking at the socio-economic and environmental risk factors associated with COVID-19 disease health outcomes. Yeah.
Thanks very much. And just to pick up on that, a couple of the other speakers mentioned the response to the COVID-19 pandemic. And Lan Ho, I think you talked about the programme to get homeless people off the streets. And that's obviously sort of a really nice natural experiment to test different ways of supporting homeless people. Can you say a little bit more about that program and what the outcomes are potentially telling us, kind of what you know now, what you hope to know in the future?
Yeah, so I think it's really difficult to say what we know already, because that's actually quite a recent event and intervention with rough sleepers, and we are collecting data. But I think anyone who's used administrative data or data collections knows that sometimes there are time lags in that data. So the HCLIC data that we're asking for from local authorities on those people who've been helped by that programme, that's actually due in August into our HCLIC data system. So I think it's really difficult to say at the moment how well that has worked, although we do know that local authorities have supported around 15,000 people during the pandemic. So that's actually a large number of people. So we are making efforts, as I said, to try and find ways to collect data on that. I know the team within the department's been collecting a lot of management information from local authorities, but at the aggregate level, just to understand a little bit more about that. So we know that a lot of people were housed and taken off the street. Some people we know left that accommodation already, but we know there are still people in temporary accommodation, and that local authorities will be looking to house those in the longer term. So there's a kind of, there's probably a mixed range of outcomes at the moment, I'd say, that we know a little bit about just from our work with local authorities. And then we hope in the long term that the data we're collecting through HCLIC and then potentially linking that in the longer term is actually going to provide more evidence about that kind of like whether people could sustain that accommodation, whether they stayed within the housing system, or whether they ended up back on the streets. So that's really to come, I think, that, and the kind of success of that intervention, I think, as you say, we can hopefully test some of that through our data, but that's kind of what we're putting in place at the moment.
That sounds really positive, because obviously, and I'm guessing this is fairly unprecedented, but being able to house people, homeless people, in one place where potentially you've also been able to support them with kind of in-house sort of service provision or access to services in a way that potentially you haven't been able to do in quite the same way before, will be really interesting. Betsy, I want to come back to you though, because you mentioned obviously the pandemic might have caused issues around homelessness, that it might have actually increased homelessness in some sectors, the stroppy teenagers.
Exactly. Yes. Yeah. There's a couple. Yeah. So one of the things that I think is really important about administrative data, and the way that I used it inside the police service, is it becomes both a monitoring in time. So this is one of the things. Administrative data can be a really good sensor in time, so that it can and monitored in a way that's not just about the performance of, this is ultimate police speak, when you start talking about police performance, but it's this word performance, which has become a bugaboo, a nasty word. It's not a nasty word. It's a sensor about, what is the problem, and is it changing? Is it morphing? Is it increasing, decreasing? But it's a sensor. So administrative data has something to do with timeliness, which is what we're finding about COVID. And it's the other thing about COVID is what we're learning is that things are rapidly changing. So that's the other nice thing about the sensor. But in order to think a little more long-term and wider about what are the research issues connected to that, you need more time to be able to think about who are the people, what are the kinds of problems. And linked data can enable you to do that faster, but it also enables you to richly understand what it is about people. So homelessness may have been increased, for example, on people with no course to public funds. That suddenly people who had no income, who were able to earn some income and yet are living outside the state largely, they may have been chucked more out onto the street or in very home insecure situations. Situations with teenagers in homes where maybe the parents or parent has issues and problems with mental health or substance abuse, and living in that kind of confined quarters just led to a blow up and a bust out. And on that the kids themselves may have busted out for a variety of reasons. So my sense is thinking about, again, different ways that homelessness affected us, we'll learn. I think it's an incredibly rich source to be able to look at those who were housed and then look at those who might have been picked up in other ways. So, how many fixed penalty notices on that other population. So we might be able to find a source that will be able to give us some information about them too.
That's really helpful, thanks. So if we go to questions from the audience now, and sorry for the 5-minute delay on that, but that was quite an interesting discussion to follow. So we've got a question here. So it's to all the panel, but potentially one for Lan Ho to answer first, or possibly Ben. But how is individual data confidentiality aspect ensured, and after record linking, how do you then make sure that the data is anonymized?
Do you want me to answer that one first?
Yeah, if you go ahead, and then other panelists can come in if they like. Yeah.
So for our project, we have ONS is acting as our data processor. So they're acting on our behalf, and they actually handle the personal identifiers. So our department, we hold what we call the H-click attribute data. So that's all the data on people's support needs and their housing outcomes. And ONS are acting as our data processor, and they create what we're calling a lookup table. So that is unique identifiers. So the local authorities create a unique identifier on their data set. So that is the same across the personal identifiers and the H-click data we collect. And then ONS create a lookup table for us. So when we're looking at the attribute data, we do not know whose data we're looking at, but the ONS create a lookup table so that we can not only see if cases are coming back into the system, because they may get a new local authority ID number, but we can also, using ONS as our data processor, we can use that lookup table to link it to the other data sources without actually using the personal identifiers. And there's a whole range of kind of organizational data security measures in place to ensure that the data is never looked at the same time or by the same people, and that, anonymity is absolutely key to the projects, and it's something that we try and introduce as early on as we can into the project.
Thanks. And I should say about the ONS Secure Research Service that under the Digital Economy Act, researchers are not allowed to see personal identifiers as part of the research data. So they will only ever get to see the variables, the attribute variables, essentially, that they need to see to do their research. And even then, that it's kind of portal access, if you like, so the data never leaves the ONS building, and in that sense it's secure, as well as obviously the researchers need to be accredited themselves as fit and proper researchers, and their projects need to be accredited by the Statistics Authority as well. If I move on, the questions are coming through quite thick and fast now, which is excellent. So somebody has asked that they're quite new to this topic but would really like to know more. Is there a way to see or share international literature or documentation or papers related to homelessness? So I think, Serena, you spoke about the evidence base around this internationally. Do you want to answer that question?
Yes, well, we are sort of the work I mentioned, the sanctions, the scoping review of sanctions impacts has been commissioned by the Journal of Social Policies, actually, and is being finalized. We are hoping to submit for review during the next month, so it will be probably appear as published in future, in the next months.
Excellent, thanks very much. Does anybody else want to respond to that before I move on? No, that's fine. So data linking is of obvious benefit to government, but how can third sector groups working to end homelessness benefit from administrative data insights?
I'm happy to talk about that because I've work a lot with certainly third sector organizations around domestic violence, and thinking about how their own information on who they're in touch with, who they house, who they refuge, how many, who they are, where they're from, what their problems are. That enables them to begin to start comparing with official information. So that's one way. The other way is to pair with academics. Academics' lives are made rich by impact, and that indeed having those kinds of collaborative and cooperative efforts really do enable different kind of insight, pulling the research into the way in which you deliver a program, monitor your program, monitor your impact, very important. A lot of it can be done through just using administrative data. That's what I learned, and actually third sector is really, really important, because it has often the experiential insight about what are the lives of the people that they're dealing with, what are they like, so they can enable a researcher to ask a better question of the administrative data, which I think is also really important. So third sector has a lot to offer this, the researchers, a lot to offer. And I think, again, the closeness with the experience of the people, again, I keep coming back, because this is ultimately about people. So the more we find out about people, the better we can help policy. And I think it's, I don't want to help Facebook understand more about homelessness, frankly. And we've all given our data freely to Facebook. I would rather have the really rich information that government already holds on us to be done in a way which is a benefit to us. Now that means that we have to create a very good oversight function of that, but I think it's really important to say we've got lots of information that can help do better policy, and I think we need to use it.
Absolutely, I couldn't agree more. And as part of the ADI UK programme, every research project and programme that we fund, we help the people running it set up public engagement panels. Particularly, we're really interested in hearing from third sector organisations that are working to support people that are within the criminal justice system, for example, or working with the victims of crime, if we're thinking about the Ministry of Justice Data First programme. But yeah, absolutely couldn't agree more that we definitely need to involve those people in the discussions to make sure that we're thinking about the right research questions when we're doing our work. Another question, are there any methodology papers on these record linking and the role of ONS? Ben, do you want to answer that one?
Yes, so there are methodology papers on our website. The methods that we use to compile our homeless death statistics are on the website, and also some of our recent linkage studies. So we've done a lot through the COVID pandemic. We've done a lot of analysis using census mortality linked data. So yeah, I can share those links with whoever's interested.
Excellent, thanks very much.
And I'll just advocate Splink, which is the MOJ data linking methodology as well, and that is also on the ONS website.
Yes, and all the code that MOJ have used to link is being shared on the relevant open source websites as well. So they've been very, very proactive about supporting that kind of work, because obviously, it's all about us all learning from each other. And if we worked out within the Ministry of Justice Data First programme, there are no individual identifiers, so they've had to be much more creative about how the linkage is done, and how you can test whether you've linked the right data to the right person. But yeah, so very happy to share those links after the session. Interesting question here. So thinking about Serena's work, but it's a question for all of the panel. Will linking homelessness data to data from other departments end up with those departments being more mindful of the knock-on impacts of their policies on homelessness? So I don't know who wants to take that question.
Yeah, well, I can. What I can say is that it has been, let's say, an opportunity that it was created by the COVID-19 pandemics, actually, by bringing together all these data sets in a safe computing environment, and I think it's unprecedented. I mean, we were after this data sourcing for quite a long time, and now suddenly everything is happening quite quickly. And I think there will be certainly this is also creating opportunity for collaborations across different departments. I mean, government, academics, but also third sectors, organizations, and I think there will be it's actually opportunities for thinking about the design of future policies around this, I think.
Yeah. Absolutely, yeah. So that's clearly a lot going on in Scotland around that. I mean, Lan Ho, I don't want to ask you to speak for other government departments, but I mean, I've always got the sense in interacting with Whitehall departments that, you know, their heart is in the right place. Just because things don't get done, it's may well be because the evidence isn't there, because they don't have access to the data. But if we do get better data linked up, you know, do you think there are mechanisms whereby, you know, policies could be put in place to support these people better?
I do think that so from the conversations that we've had with other government departments about linking our homelessness data to their data, so the departments we have most contact with at the moment are DWP and MOJ, but we're also talking to health as well. So Public Health England and NHS Digital about linking to their data. And I do think that those organisations have a genuine interest in understanding more about how their policies interact with, you know, the policies that we have, and by understanding that a little bit more, they can then, you know, they can gather the better evidence and they can then make better decisions. So I do think that all of the government departments that we're in contact with at the moment and planning to link our homelessness data to are genuinely interested in understanding more about the policies that they have and us providing that evidence to allow them to make better decisions. So I don't know if that's a good answer, but I do feel that there is genuine interest out there among all of the departments we've been talking to about gathering better evidence, because we know that these things interact, that they're not, you know, they aren't things that happen in silos or without other factors influencing outcomes. So people do just want that evidence to be able to inform better decisions, I think.
Yeah, and hopefully that's where ADI UK is helping, you know, to facilitate these data linkages across government, and then for the right people to have access to that data. Absolutely. Just
a quick thing about the cross government is that what's it like not to have information? And my sense is that policymakers are now much more hungry to have that information, because you don't want to be caught out. But one of the things we've learned from COVID is actually the science really does help guide better ways forward, as confusing as that's going to be, because actually this virus is not going to act like anything we've dealt with before. So we need to learn how to manage it. And the only way we can do that is to follow what the science is telling us. And so I think we have learned that from COVID, the pandemic.
I think that's a really positive note to finish on, actually, Betsy, and it's something that I've remarked to people on in the past few months, you know, that the public has a much better understanding now of the importance of evidence-based policy making than they would possibly be expected 6 months ago even. So yeah, on that very positive note, I want to thank you all for sitting on this panel and joining in this discussion with me, and for the audience as well for their great questions. Thank you. Bye.
Thank you.
Thank you. Bye.